Thank you. And first of all,
Mike, please. Mike.
thank you, to be in this room because I am not a researcher and probably never thought of myself as being a researcher, and have spent the vast majority of my life here in Washington as a lobbyist, which means that I have to translate pretty complex information to folks who have maybe 2 minutes to understand it, the famous elevator speech kind of requirement for your job. So as I thought about the responsibility that originally was part of this panel, and then, Michael, your instructions to us both last night, and then sort of amended this morning to make it possible, I think, for us.
Well, you're the perfect person. You can do everything in 2 minutes.
Yeah, I'm gonna give it a shot here. But I'm also struck by the fact that the people in this room and the people that I talk with on a daily basis speak different languages. And if we don't begin to think about that, I think that there will be problems in conveying the importance of not learning, but the importance of individual research projects and what folks are doing and why that's significant for healthcare. If we can't cross that communication bridge, I think we will have lost a big part of the battle. And I realized as I walked in the door to this meeting that I didn't really know what PCORNet was intended to do. And so I think that I don't deal with a lot of CEOs, but my board is the CEOs of really fabulous health plans. The CEO of Group Health, the CEO of Health Partners, you heard from Mary, the CEO of Tufts Health Plan, even the CEO of KP attends our meetings on occasion. And so I spend a lot of time thinking about what makes those folks tick and what matters to them most. And learning clearly matters, but learning in an environment that delivers for the public, for all consumers, for communities, for the nation around the triple aim is what really matters. And as somebody said yesterday, you can't just pick one out of the triple aim. You've got to do all three. It's got to be experience of care and the broad definition of what that means. It's got to be better population health. And it's got to be affordability. It's got to be lower cost. I didn't even want to think about bringing charts that showed you the fact that the government's operating in a deficit and it's not getting better. And yeah, I don't really think, I would love to think that we would be on a trajectory in healthcare costs that we've been in the last 2 years. I can't really believe that. And I know that all purchasers, individuals, employers, the government, buy on price. And they may factor in value if they've got a little bit of discretionary money, or if they've managed, or if they're confronting a very serious disease within their family. But beyond that, they're buying on price. And where does price come from if you're one of the CEOs that I deal with? That's premium. Premium from individuals, premium from employers, premium from the government. That's all the money you have to play with. And so in the research community, what that means is the work that the research community is doing to learn for today and for the future has got to show up as competitive advantage, one way or another. Now, that's not all in price. It might also be in credibility currency. It might be in trust with the consumer and the patient environment. Those things matter. But I think in the terms of CEO appeal, it's been said already. What is the applicability for lower cost, for the right care, for trust with consumers, for competitive advantage? How does that really factor into the organizational strategic position? And Pete, every time I see Bellin's work, I am just, I kind of live in that way of thinking about things. But I think you all say it in such a crystal clear way that it's kind of hard to not memorize it in a second. Fail forward fast. Value at speed. Joe, make sure that every CEO that enters that room has an understanding of what PCORNet could mean to them as they walk in and out of that door. Infrastructure element, I think Brent James did do a fabulous job there. He talked about priorities. He talked about setting up the structure to get to those priorities. And I also think that one of the things that I heard here is that constant, really healthy tension between solving disease as a function of research, really ending disease of one sort or another, and making systems work better so that it can deliver better on population health. And I think CEOs are confronting that constantly, and you have to sort of bring those two things together to have a conversation with them that relates back to priorities. On obstacles to take on, I would go back to my first comment. I would say communication. Communication that enables folks throughout your entire organization. Ray, I commend Kaiser Permanente for what you all have done throughout the entire organization to understand what you're doing and why and how it's going to matter to them. And that's not just the operational leaders, but it's a much broader perspective. CEO steps for engaging patients. I think that whole issue of trust currency really matters. Strategy with the board. I think that most boards are really focused more on service to the community, making the community of people that organization is dependent upon really invested in that organization. That's probably what governance leaders bring. They will be influenced by the cost issues, but they're going to hold the accountability at the C-suite level for those cost issues. And so they're translating that into a strong governance model that respects learning and that balances what's going on there. 2020 vision, population health is improving. Communities, not just individuals, but communities are healthier because the healthcare systems that operate within those communities are healthier.
Thank you, Patricia. Janice?